I'm so happy to be here. I'm Christina Farr. I'm a healthcare reporter with CNBC, and we've got our mystery speaker, who is Karen DeSalvo, and she's joining us from Google Health. So, Karen, how are you doing in this crazy time of wildfires, pandemics, everything? Are you holding up okay?
Yeah, I am holding up okay. Thanks for asking. It's really good to see you actually. And I feel grateful that I'm navigating it okay. My family's been doing fine. My husband's an emergency medicine doctor, so he's been busy in the ER seeing patients with COVID and everything else, and he's very thankful that he gets to be helpful in that environment. So we're holding our own, and I'm just thinking about a lot of people all over the world who have a lot of struggles. So I appreciate you raising that right out the gate because we have a lot of world healing that we're going to have to do for some time going into the future.
Absolutely. And for you, this must have been a strange time because you started this new job at Google Health. And I
Hmm.
can't imagine you have very long at the office before, you were told essentially to go home and we were all quarantining. So how has that been trying to sort of immerse yourself in a new job, sort of right at the beginning of this?
Yeah, it's so I started Google at the beginning of December in 2019, so it's been just about 9 months. And for the month of December and for some of January, I was actually on travel. In fact, I was in the UK at our London offices in January and saw a report that the Public Health Service was starting to do screenings at US airports for COVID, which was an alert for me that there was a very serious challenge afoot because the Public Health Service was part of my team when I was at HHS, and we stood them up to do screenings for Ebola in the airports, and I knew that that took a lot of work and it was not a small call to make, and so it was a signal to me that we were about to have a global challenge with the virus that was just starting to emerge. Got back to the U.S. And things continued to unfold, but we were already working starting in January as a company to put out what we call an SOS alert to start to get better search information available for people. And early in the process, I got asked to be a part of the company's central response. So I had this experience of joining the company for a role in Google Health, which was about improving authoritative content and accelerating, digital health and meeting people where they are for care. COVID, as we can talk about some, has been an accelerant for that. But I was also just glad that I could be there for the company at that time because, as you know, I've been through a number of disasters in my career, and it's been a chance to kind of lean in and be helpful. When you are in a crisis like this, people are at their best, I find, and they work really collaboratively. I have learned so much about this company in a really short period of time. So it's been a horrible thing to have happened, but I'm thankful that I was able to be at Google in these last few months and be helpful where I could.
Yeah, and Karen, one of the things I think we've seen Google do just from the outside that a lot of people have been following is the work with exposure notifications,
Hmm.
and that's something that actually was done in concert with Apple. Again,
Hmm.
unprecedented. I haven't seen in my career at least Apple and Google joining forces on something, especially something that was put together in a matter of weeks. Just in following this story, it seems like certain countries have absolutely embraced it, and we've seen apps come out for contact tracing, in places like Germany, and then you've seen the US have a bit of a stilted response with just a few states putting out these apps. So, how much can you walk us through kind of what the process has been there, and what does it say about the state of public health globally? That
Right.
some countries have really thrown themselves into this while others are proving it sort of challenging to get their act together.
Okay, I want to talk about so many things that you just raised in there. So I hope that we can have some
Big
follow-on
question.
here because I really want to talk about the technology itself and that experience of Apple and Google and now Microsoft being involved in partnering with public health in the U.S. As I think you know, a part of my background is I spent time in public health and at the local level in New Orleans, where I was health commissioner. One of my big frustrations was that I had surveillance data for chronic disease, especially, or for quality of life, or sort of big indicators that was often pretty stale, sometimes a couple of years old, because it takes a while to get packaged. And even in these big scale CDC led efforts, it just takes a while to have good insights. And we were just beginning in public health at that time, this is around 2010, to start thinking about novel signals. How can we use social media or other kinds of data that could be more real time and inform us about the public's health and their perceptions or sentiment about the challenges they were having? I mean, like I remember looking at the epidemiologic data that we had for New Orleans, and walking into that job. Okay, well, the big priorities for our community are cardiovascular disease, cancer, diabetes, obesity. This is the list of things that we'll have to work on. Did a very traditional public health thing, which is go out into the community and have listening sessions. You do it in a church hall, or you do it in a community center. And what the community told us their challenges were violent mental health, violence, and jobs. I mean, that was sort of, because and I say violence twice on purpose, because it was a really big priority. It didn't show up in any of our public health indicators, but probably it would have shown up in some other kinds of novel signal information. So that has been a journey for me to want to build a bridge between technology, not only in the healthcare space, but also technology companies with public health, so that the leaders on the front lines have the information they need to make decisions, to be responsive to local community, and to be helpful, which is what they're there to do. But it is, as you allude to, a struggle for public health. They're chronically under-resourced globally, so they don't even have often some of the basic technologies that they need, hardware, basic software, and don't have the workforce who has had some training in 21st century tools like developing apps. So as we started this journey with public health, I told my peers and colleagues here at Google, look, you take for granted a lot of what you understand about the world, and public health is got many skills and things to bring to the table. Technology is not one of them. So let's be their partner, and figure out all the ways that we can have them on that journey. And I remember how, first of all, everyone's been great at the company. Google trying to work with and partner with public health to help them understand what an API can do, and what Bluetooth low energy is, and how it can be used for contact tracing. These are, in many cases, new concepts. But there was a day when the news started getting reports of things like fax machines being the source of receiving test results. And someone sent around the article. I think it was about the Houston case where it happened, and I just thought, well, yeah, but of course, that's what I've been trying to tell the world, for years. But seeing that on the front page really made a difference. I think it honed in for folks that it wasn't just a story; it was real. That there were even interface challenges, basically. And in the scope and scale of this pandemic, it's really stressed the public health IT infrastructure. So happy that we've been able to partner and kind of advance it. We can talk more about the progress that we are making. Like California just announced a Western coalition in the last couple of days. So we're getting a lot of states coming on board, but it's not unsurprising to me is the point. I mean, public health has an important job to do. They've been under-resourced to have the technology and data that can allow them to do that job in real time. And I think this pandemic is showing us the way new partnerships can be helpful there.
So you've definitely spoken to, the defunding of public health and how much we are sort of living in that reality right now. But another thing we're facing is just science communication challenges across the board. We are certainly, I think it's quite clear that the science around masks and how important that is, and social distancing, and Google seems to be creating all this technology to make it easier for people to do those things, and for public health to incorporate, some of this into their own surveillance. But how can that work if you don't have the public on board, kind of doing the basic measures that we need to do to control this virus? And what are your thoughts on that?
Well, let me try to take it in two big buckets. The first would be communication is job one in any kind of a crisis or disaster. And it's always the most challenging thing. And every after action that people do about a crisis or disaster, they say the thing they needed better was communication, and the problem they had the most of was communication. And that's between the parties that are working on response, but it's also with the public to get them the right information in a timely fashion so they know what actions they should take to protect themselves. We think about that a lot, for an evacuation, for a disaster, as an example. But in a pandemic, it's obvious also that you need to have people know where they can seek information about testing or get tested. What's the knowledge about mask wearing or hand washing? What we were calling Do the Five at Google. And here again, things that you think but you don't realize until you're acutely faced with it. Google's a consumer company. People come to us for information, but the opportunity that we had to put authoritative information done in partnership with the World Health Organization, the CDC, the National Health Service, in a place where people are going to naturally go every day. So we don't have to go to them; they're coming to us by the billions, and we need to make sure that we're putting out information that will be accessible to them and make sense, and then also point them to more detailed information from their public health authorities. It was, I mean, it's just been great to be able to partner with public health to be able to do that in a way that gets that information out there. And public health mostly can manage that, because what they can do is create the messaging, right? Sometimes their websites need a little forewarning. There might be some more traffic coming at them, especially in some low and middle income countries. But those are things that we've learned to work with folks around the world on. We've also been able to use surfaces like YouTube to work on content that is more targeted towards audiences. So you're talking about maybe not everybody responds initially to social distancing or masking or other information. So what we want to learn is, who are the influencers, who can help get that scientific information out to the audiences that are going to be ready to receive, whether it's young people or seniors, whoever that is. And so we did a lot of work with influencers on our YouTube platform, and sometimes partnered with, bringing Tony Fauci on, sometimes just have the influencer give the information out. So that's the public health messaging, consumer facing part of what we did, and there was an array, and we will continue to do that going forward in partnership with public health. The rest of it is also about providing data so that public health and medicine and science can create insights. So I mentioned novel signals like search symptoms or symptom search data, or the community mobility reports we've done, which is about how the busyness of retail or business or transportation sites. So we would have this anonymized data. We worked out a way to be privacy promoting, make it available not only in reports like the community mobility reports, but the data also, so that the public health community, the scientific community, and the medical community could make use of it to make evidence-based decisions. So we felt like we had, and we still feel as though we have an opportunity and a responsibility to provide those augmentations and support, not only to people, to individuals, but also to those that are trying to help develop new science, and get that information out to the people who need it.
So I think we've already mentioned this, but this isn't your first crisis. You've been through crises before. One of them being Hurricane Katrina, which you were a health commissioner, and you've given interviews and said that was a really eye-opening experience for you, just in thinking through what needs to change about New Orleans's healthcare system, and you did a lot of things in the aftermath of that to make those improvements. So when we look at COVID now, it's obviously changed a lot about our healthcare system. We're seeing telemedicine, that at levels that we've never seen before, but we've also seen fee-for-service medicine kind of really suffer. A lot of us losing a lot of money. So, what do you see as kind of needing to change in the aftermath of this pandemic? Because we've obviously laid bare a lot of both the strengths and weaknesses of the current healthcare system.
Yeah, crisis brings out the best in people, which I said before, but it also really puts a spotlight on where there are broken parts of a system or missing parts of a system. We learned that in New Orleans, and we certainly had known for quite a while that we needed a healthcare system that was less centered around the doctor and the hospital, and one that was more centered around the people we were serving, one that could meet people where they were. which is a kind of sounds like a kitschy expression, but it was actually a real lived experience for us in New Orleans after Hurricane Katrina, because all of the bricks and mortar were flooded or closed because there was no power, sewer, whatever. So we literally had to go to the street to meet people where they were and set up card tables and get ice chests to put tetanus vaccines in, and bring our own literally black bag with blood pressure cuffs and whatever to serve people in their neighborhoods where it was high and dry and they could find us more easily. And that led us to grow out of that urgent emergent system a neighborhood network of community health centers that provided primary care, mental health services, addressed social care needs, and did that in a very collaborative fashion. We jumped into electronic health records in New Orleans. We needed that more real time information from the visits we were seeing to plan for the next week's supplies. I mean, it was that real time. Like, oh boy, we're seeing a lot more asthma or diabetes, so we need to see if we can get some more of the supplies that our patients are going to need going forward. So a lot of things that happened to us in that experience in 2005 that shaped the way I think about what we should be doing for healthcare generally. Meeting people where they are, using data to plan for the future, to be more preemptive in care needs, being more centered around the cultural um, and 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 neighborhood-based needs, to really understand the context in which you're serving people and be a part of that and do it with them and not for them. These are things that we lived, and I think what COVID is teaching us in a very similar fashion at scale is the same things. We need to be able to be flexible enough, but also prepared to meet people where they are. And in this case, it's been digitally through telehealth and even telephone services, but other ways as well, chat services, whatever that is, to be there for folks if they and not expect that they're going to come to our brick and mortar. We need to be able to enable a system with digital tools that are lighter and nimble, but also can help us have individual level continuity of data and population level data to plan, to understand what is the collateral impact of COVID. As an example, it's not just about the physical disease, it's also about the mental health impact of COVID. It's also about pent up demand or not managing chronic disease. So there will be all these other collateral issues that the data is already telling us, right? But it's gonna continue to. And so we need to have a population view. And I think we're also learning, and I hope it sticks, that it's not just about physical health, that context matters. So that's where people live, learn, work, and play, and their ability to access resources. Sometimes we call that the social determinants of health or social health. And then, of course, mental health. So this triad of a physical, emotional, and social health, it's become readily apparent to the world that they're all interconnected, because I think everyone's living it every day. Like this is also, by the way, part of our issue in Katrina. A lot of my doctors and nurses were lost their houses, so they were homeless, more temporary than people might be, but they had a glimpse of what that was like, to feel so unsettled and so uncentered and so uncertain about your future. So it created this shared sense of, we must do this together, and we're having that, I think, literally as a planet. So I don't want us to lose sight of the opportunities that we're going to have. And it's not just about telehealth. It's about, like I said, meeting people where they are, thinking holistically about their health, and being smart about how we use data and information to be supportive of people and communities. I'm optimistic. We'll see what happens into the future.
Well, that's good. I sometimes waver between optimism and pessimism, so could use it.
Perfectly normal. Yeah.
So, you've also had a big role in the federal government on the health IT side as the former national coordinator for health IT. So, how much does it bug you that we still haven't solved interoperability and that we are still reliant on fax machines in 2020? I mean, what other industry still is but healthcare? And when are we going to fix that?
It bothers me a lot. And by the way, the other industry is maybe one that's even more important, and that's the social care sector. Has an even weaker and older IT infrastructure than medicine and public health. So when you want to think about food access and housing support, or even what we've learned about unemployment insurance. We've got a lot of broken IT systems, but it doesn't excuse what's going on in the healthcare system. And I think many of us in this space know that the technological solutions exist. And they existed even before fire came around. But with fire as a standard, we have even a better opportunity to create interoperability. What we continue to struggle with is the will. And sometimes that will can be pushed by a business case. We certainly used that approach when I was in the administration to couple interoperability standards, expectations, and performance with value-based care, and link that not just through the meaningful use program, but start to bridge that to other expectations, ACOs, and other kinds of models. This administration has carried that forward and actually really advanced the idea that even insurers, Medicare Advantage, Medicaid, and marketplace plans need to be able to create a longitudinal health record for people. So you're seeing this kind of coupling with the business case and saying you're a 21st century healthcare system. There's no technological reason why you can't have interoperability. So let's keep pressing forward on that. And so I'm quite supportive of the push, but there's a pull also. And the pull is, I think, the part we haven't quite figured out for people yet is how do we make it so that your health data is relevant to you, relevant enough that you want it to be a part of your life flow and your workflow and your feeds that you get all the time. We still think about health data as a portal that you have to log into to look at your last mammogram result, and you're only going to do that at some interval, rather than thinking about health data as part of this overall quality of life. And how can we keep you abreast of science or peer groups or other relevant information that makes you want to be more engaged in your health and want to pull that data so that you have birth to death records, so that you can be a part of science, so you can be a part of public health. And I think we've had a few places where we think that we're trying to get some better pull. This might be an example where people are going to want to have access in real time to whether or not they've had a COVID vaccination or what their last COVID test result was. I think there's going to be an impetus in the next couple of years that's going to be stronger for even the average person just to live their average life than we might have had in the past, which is unfortunate. But if we'll allow that pull to happen along with the push and not fight the technology, I think we could get into a place where it would feel more seamless for people. And I wish that we would, because it's their data and it's our data, right? Our own data about ourselves. And the fact that we wall that off or silo it off or make it so difficult for people is not constructive for what we want to get in terms of a healthy population. I have preached about this a lot in the past, so I won't go on anymore, but I feel really strongly about it, that there's an important, an important responsibility that we have to every person, and a right that they have to have access to that data. And so if we can come out of this pandemic with some nicer mix of push and pull and use of that technology and a respect for the user, that I think that would be another good outcome.
Okay, great. So we're coming down to our last couple of minutes. I'm going to ask you, one very quick question, and then we're going to play a short game.
Okay.
Quick question being, in a sentence, if we're imagining we're doing this panel in 5 years from now, what would be the one thing you hope you would have accomplished at Google Health, or hope most, assuming you do more than one thing, but.
So I have two things. Because my job is kind of in two buckets. I have my Google Health work, where we're working to organize health information and make it universally accessible and useful to people and those they trust. And so that's a harmonization of health data, not just healthcare data, but our social care data, our social determinants, our wearables, into a format and a place where I decide where I share it and when. So a consumer directed exchange model, and that then the world can build features on top that allow health and care to be more preemptive, so you can better predict the future and organize your future. I want to say that for the company, Google as a company is a health company. We are other things as well. We're about happiness, but it is so a core part of the way that we want to help people, and we can. And what I do hope as the years go on is that these partnerships that we have built with the public health community in areas like contact tracing and the mobility reports and data, that's the foundation of a partnership that we can expand globally to support public health in addition to the other sectors that drive health, because that they are statutorily accountable for health and upstream supports, which I think is essential to getting quality of life for everybody on the planet.
Okay, in the last 20 seconds, I'm going to ask you a series of things, and you're just going to say underrated or overrated.
Okay.
All right, Taylor Swift.
Underrated.
Telemedicine.
Overrated.
Interesting. The potential of tech companies in health.
Unknown.
The U.S. COVID response.
I'm gonna demur, but I am gonna take a minute to say, on the part of a lot of frontline public health workers, underrated.
All right. Well, thank you so much. I wish we had more time to delve into some of those responses, but I had a great time chatting with you, and hope we can do it again.
I hope so too. Thank you so much. It was good to see you. Be well.